Hi, baby. All right, that's a little tender, I know. And now I'm gonna massage in there. So now I'm in the pole area. That's what we say on a horse.
Good boy, Wayne.
Here's a spot here.
Okay.
Got it. Here's one. That's a bad spot.
Right, I got you. I got you.
RAYNE has some definite rear end issues. As you could see in this little clip I'm showing now, you know, his leg, especially that rear left, will even cross over here. So we have RAYNE back, and we have Phil, the owner, and let's go back over here so you can see Janet's here too. And RAYNE is their family member. RAYNE is 12 years old.
12 years old, yes.
German Shepherd, if you can't tell, or you didn't watch the first video. So this is the second video, exactly 7 days later. When you left, and he's 12, as we mentioned, when you left, you saw some improvements that were short-lived.
Yes.
Can you tell us about that?
Well, just walking out of the building, we noticed that he had more step, a little more, a little more kick in his step. He wasn't dragging his feet as much. And he seemed to be a little more anxious to walk.
Anxious meaning happy?
Yes.
Or do you mean anxious worried?
Anxious, happy.
Okay. And then after a few days it faded and he started to
It started going back to where it was, but he's still better than when he was before his first treatment.
Okay. And then I also heard you say that he was more looking forward to going out for his walks and...
Yeah, he likes... we live near some parks with a lot of grass, and he likes to go there. And now, when he knows we're going there, he's actually pulling on the leash.
Okay, good. So he's got enthusiasm for movement,
Right.
which is nice.
Now his endurance isn't as good as it used to be.
And we talked about he does have some muscle wasting, so that's going to get tired out really fast.
Yeah.
And excuse me. So maybe we're going to bring the leash in. Yeah. One of the things I wanted to address, which I talked with Phil and Janet about before we started rolling the film, is as a human chiropractor, I remember I had a professor years ago that I really liked, and we would ask him questions like, how often should the person come back, your patient, to get adjusted? And he'd say, as soon as it starts to fade. And so maybe someone is older or has more of a serious problem, they might not hold their alignment for very long. And but if they get one treatment, then two, and it starts to be accumulate, that they might need less treatments or spaced out because they're now stabilizing. And Janet was even mentioning muscle memory. So muscle memory kicks in also. I used to describe it as almost, did you ever see someone spin a basketball on their finger and it's spinning and it's spinning, and when should they get another adjustment? Just when it's about to fall off the finger, and the adjustment would be another tap to keep it going. And so it's good that he's here today because he's ready for a tap of the basketball, spin. Right? Another spin. So can I work with you today, RAYNE? What do you think of that? I'd like to ask. Gets to think about that for a second, and we'll get started. We'll see what happens. I'm going to work by hand, but I also might do a little fine tuning with some of the instruments too today, but I would be very light. There's one instrument I might try today, and this is percussive, and it's very good for arthritic spines because I can make a very light level, and it has 12 impulses per second. So some of the speed of the rhythm on this is called an Arthrostim, so it's a medical equipment, so it's not something you'd have to prove that you have a license to buy this. You couldn't just find it on the internet. They won't mail it to you. But it's very good for arthritic spines and or for spines that have a little bit of degeneration. And I'm first going to do everything by hand, but at the very end I might mobilize. Let me show you what it feels like. So it's light.
Okay.
But what's nice about it is I can get into an area that's been stiff and give it a little undulation, a little. It's almost like a lubrication. It'll make it slide a little better.
Mm-hmm. Okay.
But it's available here if we need it. I'm not sure if we do, but that's what that's there for. Okay? So, hi there. Thanks for coming back. And if it's okay, I'm going to work on you a little bit, okay? All right. So I'm going to start here at the atlas. And definitely tight on the right, and I think that's where he was tight last time. We'll have to go back and look at the video. So I'm going to come in here and just pull this down a little bit. Ooh, that made a crack. Could you hear that one?
Unfortunately, I didn't.
Janet, did you hear it?
Yes.
Yeah. Okay. Let me feel the spacing. So there's more space there. And what I was doing is I got between the wing of the atlas, and which is the top bone, and it was wedged up a little bit against the skull, and I pulled that wing down a little bit, just the right aspect. And now I'm gonna massage in there. So now I'm in the pole area. That's what we say in a horse. And I'm just gonna massage that for a minute. See if RAYNE likes that. Hi, baby. All right, that's a little tender, I know. So let's do. Now, this is important for the rear end too, because this is like the circuit breaker for the spine and the back. So very often on horses, dogs, or any quadrupeds, when we release this top area, you'll get a response all the way down. And I'm checking range of motion, pulling the head down. Good, and bringing it back up. Sorry, baby. So that's a little stiff in there. And that could just be from the aging process. There you go. Let's try one more time. All right, sorry, baby. I just want to check. Okay.
Good boy, puppy.
All right. Let's go down the neck now. All right. Now I'm in the lower neck. Oh, don't go anywhere. All right, so now I'm in the lower neck. I'm at C5 on the right, and I found a little muscle knot. So I'm gonna start working on that next. And I'm down in the lower neck on the right. And I'm gonna, got it? All right, come back, baby. All right, so now I'm gonna come down the back. All right, I'm gonna keep you up.
Boy, Wayne.
Here's a spot here.
Okay.
Got it. Here's one. That's a bad spot.
All right, I got you. I got you.
So that one I might do with a quicker, lighter instrument.
Okay. It's all right. It's all right. Good boy. See?
Got it. Okay, there's it. Okay, that's another one.
Where you going? Come on, man. You have to come out.
All right. Now I'm touching real tender areas. Here, can you hold right here, Phil?
Sure. All right, good boy. It's all right. Where are you going?
working quietly and methodically because he's stressing out a little bit about this, so I'm trying to get the work done. Sometimes it's a good time to stop talking and work. And now I'm on the back left hip. Here it is. Now my thumb is in the, right around the hip socket, and I found a big spasm and I'm rubbing into that and massaging it. But I'm doing deep tissue work on this and trying to get it to release a little bit. There it is, and that's a tender spot. I do the same thing on humans, and this is the point that's would match that on a human's hip. That gets, that we will see with chronic pain in the hip. And now I'm working a little bit around it, like I'm going counterclockwise around the head of the femur. And thank you, that helps. And now I'm here on it. And I'm gonna just do a little impulse. Got it. Okay, good doggy.
No, you're staying there. You're staying there.
All right, I think that's good. I'm done.
You're done.
So let's walk him around a little bit now, okay?
Okay, come on, let's go for a walk. Come on, Rain. Go this way. Come on. Okay, let's spin around. Come on.
Come back this way and walk backwards, Lisa. All right, so we're gonna finish there today. You guys are invited back if you want to, keep
Yes.
up with this, and leave Rain a comment and encourage Rain to have a good day. I hope. Okay. Thanks everybody for watching.
Thank you.
Okay. And now I'm gonna massage in there. So now I'm in the pole area. That's what we say on a horse.
Good boy, Rain. Okay.
Here's a spot here.
Okay.